Hi, I'm Dr. Chandni Bhimani. I'm a breast and body radiologist at Atlantic Medical Imaging with special interest and special training in breast imaging and breast biopsies. In order to prepare for a mammogram, you first want to make sure you don't have any active symptoms. As long as you don't have any active symptoms, you would be scheduling yourself for a screening mammogram. Important things to remember are any family history or personal history of breast cancer or other gynecologic cancers. Also, you want to make sure that you're not wearing any deodorant the day of your mammogram. If you are, just make sure you let the technologist know so you can wipe it off. And then you just want to make sure if you have any prior imaging that you bring it to that facility so that the radiologist has prior imaging to compare to. All women, specifically average risk women, should begin screening mammograms at age 40 and then continue every year. If you have a family history of breast cancer or other risks, you may have to start screening mammograms earlier. Please talk with your doctor. Breast density describes the amount of dense fibroglandular tissue in all patients. All patients' breasts are composed of fatty tissue and dense fibroglandular tissue. The more of that dense fibroglandular tissue you have, the more white your breast appears on a mammogram. The importance of that is that the cancers we're looking for, but also benign breast changes, are also white on the mammogram. Breast density, your normal breast tissue, can cover up a finding on mammogram, and that's why we use different techniques such as 3D mammogram to try to see through the breast and to be able to find something that might be hiding in your normal breast tissue. For a screening mammogram, you will typically get 2 images taken per breast. Images are taken using a low-dose technique, which is the 3D mammogram. Some machines can take up to 15 low-dose pictures that are then reorganized into 1 millimeter slice thicknesses that can then be reviewed by a radiologist to be able to look through your breast tissue and identify anything that could be hiding there. Mammography is an X-ray technology that we utilize to obtain images of your breast. The difference between a screening mammogram and a diagnostic mammogram has to do with the reason for the study. The images are the same, although in a diagnostic study, we're able to take more images to work up a specific finding. A screening mammogram just means that you don't have any concerns, nor does your doctor have any concerns. A diagnostic mammogram may be because you were brought back from a mammogram to further evaluate an area. Diagnostic mammogram may be because you have pain, you feel a lump, or your doctor feels a lump. Another reason you would be getting a diagnostic mammogram is as a new baseline following surgery. This could be due to benign breast surgery or after cancer diagnosis and treatment. Annual screening mammography allows us to detect breast cancer as early as possible. Breast cancer is a common type of cancer that we know how to treat and is best treated when found early. So the amount of radiation from a mammogram is no different than the background radiation you receive from just living day to day and doing certain things such as cross-Atlantic trips. In addition to annual screening mammograms, doing self-breast exams and annual exams with your doctor are just as important, especially given some patients may have dense breasts. You may feel something before we're able to see it. We may also bring you back for additional imaging to potentially find something that may not be evident by mammogram or not as easily seen by mammogram. Thank you for watching. If you have any further questions, go to atlanticmedicalimaging.com or talk to your primary care doctor.